Okay, well, thank you for being with us today. I'm Rachel McFadden. I'm here emceeing your session. And as a quick reminder, I don't want you to forget to join our 12 o'clock Eastern time session, which is our wrap up and our t-shirt raffle. And before we get started with our presentation, I'm going to go ahead and recognize some of our sponsors. So we will hear from the National Kidney Foundation and Peak Relief.
I was diagnosed with rejection in March of this year, so the pandemic was extra terrifying for me. While everyone was out buying all the hand sanitizer and toilet paper, I was being released from the hospital with no immune system.
My wife Michelle had a diagnosis of kidney disease. She had a massive cardiac event due to complications from COVID, and I can safely say, as a kidney patient, my wife died from COVID-19.
I lost my mom, a kidney patient, from COVID. Then I remember the last time seeing my mom alive, taking her last breath through a glass window, to not be able to touch her while she still had breath in her body. Mental agony.
We were thrown a curveball when I was diagnosed with a rare kidney disease. That scared me. It still does.
The National Kidney Foundation is doing so much to protect patients during this pandemic, to make sure that what happened to my wife Michelle doesn't happen to them.
With the Kidney Foundation's help, we've been able to overcome some of our fears and live healthier, happier lives.
The National Kidney Foundation does so much, so much.
Okay, thank you from our sponsors. Our last session of the day is mental health and well-being, living with your transplant. And I'm going to open up a quick slide. So a few housekeeping items. You may recognize this from your last session, but if you haven't been, just so you know, the webinar is being recorded. Recordings will be sent to all participants after the event. We had a general meeting room that has now, well, it will be open if you had to pop out of this and pop in. It will be open until 12. And then if you need any support, please text 410-635-0229. If you have comments and questions during the session, please use the Q&A feature to ask questions, which we will be answering at the end with Dr. Sarah Andrews. And then using the chat box, you can communicate with the other participants. This is a webinar format and you will not be able to see or hear the other attendees. You are in the mental health and well-being living with your transplant session with Dr. Sarah Andrews. Dr. Sarah is an assistant professor in the Department of Psychiatry and Behavioral Sciences at the Johns Hopkins University. After her residency, Dr. Andrews joined the Department of Psychiatry to pursue her interests in both transplant and substance abuse research. She serves as a consultation psychiatrist within the Comprehensive Transplant Center, providing ongoing psychiatric care for transplant patients. I will let Dr. Andrews take it away from here.
Good morning, I'm Dr. Andrews. So honored to be with you today through TRIO, and I'll be speaking about mental health and well-being living with your transplant. I'm a psychiatrist at Johns Hopkins Hospital since 2016 after completing both medical school and residency at Johns Hopkins, and I joined the comprehensive transplant team in fall of 2017. My role with the solid organ transplant teams has been to provide psychiatric evaluations for patients pre-transplant and post-transplant and ongoing follow-up care as necessary. And I provide evaluations for all the solid organ transplant patients, so kidney, lung, liver, as well as heart. So in addition to transplant psychiatry, I'm also an addiction psychiatrist. So through my evaluations with the transplant team, I'm also able to provide that expertise as well, which has much overlap. So throughout the presentation, please feel to ask questions in the Q&A portion of the Zoom, and I'll attempt to address as many as possible at the end of the presentation. I have no relevant disclosures to address. So the learning objectives for today's talk. So the first objective will be to understand the common mental health needs throughout the entire transplant process. And the entire transplant process is a complicated and complex process, from the beginning of the end-stage organ disease to the end of the transplant and then post-transplant care, and all the stages in between, including the evaluation process, the listing process, even the surgery. So there's lots of different stages, and we'll talk about the mental health needs throughout all those stages, in the increased risk of psychiatric illness within the transplant population. And that includes both kidney, liver, lung, and heart. So it's an increased risk with all the transplant population in general, which also includes chronic medical conditions. The third part is understanding the role of both therapy as well as psychiatric medications for transplant patients. We'll talk about medications, but also support groups that are available, as well as individual therapy to help support patients that are struggling throughout this entire complex process. And the fourth part will identify resources that are available for transplant patients as well as for caregivers. We'll talk about the role of caregivers and how important that is, and the stressors that go along with caregiving, and what's so common with burnout with caregivers and how we can work on preventing that. And as we begin with the mental health needs throughout the transplant process, I also wanted to first briefly discuss the state of transplant. So the current state of transplant has greatly evolved since the first successful transplant in 1954, which was a kidney transplant between identical twins. In 2019, another milestone was set in the field of transplantation. A record number of lives were saved. There are almost a total of 40,000 total transplants in 2019 from almost 12,000 deceased donors. So each donor can save the lives of up to 8 people, which is tremendous. There are over 7,000 living donor transplants in in 2019, which includes both kidney and liver. And for the 7th year in a row, there has been a steady increase in transplants. And as there's an increase in transplants, there's also an increased need to manage these patients, both in the pre-transplant process as well as the post-transplant process and everywhere in between listing, from listing to the wait list to the surgical process. The entire process of transplant is a very challenging process, not only from the medical standpoint, but for one's own mental health. And that's where living with your transplant, your own mental well-being is so important and so necessary to take care of. So the transplant process is a complex process. And there are many stages within the transplant process. And I've outlined here 5 of the most prevalent stages of the transplant process. So the first stage is the onset of the end organ disease. And that, depending on the organ, depending on the process of the disease, can last, it can be weeks, months, or it can be years. And it just depends on the disease itself. And that also can be very challenging depending on how the disease itself evolved. And that comes with its own set of mental health needs. And so that can last for a while or it can be very quick. So that in itself is the first part of the struggle that will evolve within the transplant journey. The second part is evaluation for transplant. And that, again, brings on its own struggles. That can also bring, you have to do all your testing. It's whether or not you qualify, whether or not this is a good choice. All of that is part of the evaluation for transplant. And that also can last a bit of time. And then the third part is the wait list aspect. And I find that a lot of patients struggle with the wait list part. They're on the wait list, and now then you have to wait for a transplant. And depending again on the organ, that can be weeks to months to years, depending on how long you're waiting on the list. And that also can be a very challenging time. The fourth step in the transplant process can often be the shortest part, the actual procedure of getting the transplant. But that also can be very stressful, being in the hospital, being hospitalized, having the surgery. And then the fifth part is post-transplant life. What is your life going to be like? And that's also its own process. And so mental health is affected somewhat differently throughout all these different stages of the transplant process. So as with the 5 stages that we discussed, there are transplant-specific stressors. So with end-stage organ disease, there's so much emotional and physical stress that comes along with the organ failing. And then there's the wait list, the pre-transplant stressors that can happen. There's so much uncertainty that happens with it. A lot of those stressors come along with, what does all of this mean? What does it mean that my organ has failed? There's financial concerns. What am I able to work? Am I able to continue to work? What will my life look like? Am I even a candidate? What will the transplant workup look like? Will the transplant actually work? What will my life look like post-transplant? And then there's the worries, the stressors of, do I actually need a transplant? Is it worth it? There's also specific transplant stressors, the pre-transplant process of role changes. Some people are unable to continue working pre-transplant. That role change of what their life, that change in life role is a huge stressor. Some people have to be on disability. That's a huge stressor on their life. Their role in their family changes. There's a lot of medical issues that come about within the pre-transplant process. Some people even might need to lose weight or gain weight, depending on their issues. There might be other complications medically that need to be addressed within the pre-transplant. All these stressors that happen within the transplant process. And within the pre-transplant process, there can be long wait times for the wait list, long process for even the pre-transplant process of having the evaluation, the workup. And then there's worries about, will I survive the wait list? Will I be able to get to the transplant? And with the wait list, sometimes psychosocial situation changes, financial situation changes. All these stressors can happen within the pre-transplant process. And between the pre-transplant and the post-transplant, then there's the transplant procedure stressors, the stressors of being hospitalized, being away from family, any medical issues that come up. And then there's the stressors of, will the transplanted organ actually survive? And eventually, after transplant, there's still going to be stressors post-transplant. There can be surgical complications. There might be delayed graft functioning. There might be, for kidney transplant people, some people might need dialysis post-transplant. There might be ongoing hospitalization needs. There might be side effects of the transplant medications that were, although discussed, and maybe not necessarily expected. There might be expectations that from the post-transplant side that might not have been fulfilled. Will my life be better? How long will the transplant last? What were the expectations of that? Will I have to, for kidneys, will I have to return to dialysis at some point? And again, even with pre-transplant, post-transplant, there's going to be role changes. When can I return to work? What will others think of me as the post-transplant? What will my body look like? Is this a new normal? Will things be back to how they were? Not even pre-transplant, but pre-disease. What will things be like? So all these specific transplant stressors are occurring. And then between the entire transplant process, there are ongoing financial concerns that can occur. In the post-transplant side, a lot of people worry about, will I be able to afford my medications? Will I be able to afford what will happen post-transplant? And there are changes that happen based on the transplant process and the stage that people are in. So with all these different stressors, the transplant process is like a roller coaster of emotions. There are ups and downs throughout the entire process, and it's a journey. There are both challenging emotions, some negative, but there are some positive emotions. And some of the challenging emotions that people experience, some people might experience some guilt depending on where they are in the process. Some of that guilt might look like, did I cause this somehow? Is it my fault that my organ failed? Maybe some sadness, some tears. Why is this happening to me? Why is my organ failing? And fear. I see people all the time that are just so worried. Am I going to survive? Will I have a long life? Will I be able to see my family? Will I be able to see my children or my grandchildren? And just anger. Oftentimes there's just some anger. This is not fair. Why do I have to go through this? A lot of times too, there's just anxiety, so many ongoing worries, fears of the unknown. What will it look like after transplant? And denial too, it's there too. Maybe things will just get better. I don't need a transplant. Maybe things will just get better. Maybe they'll just turn around. And there's a lot of loss too, loss of what life was like. There's just a roller coaster of emotions. But on the other side of the roller coaster, there are a lot of positive emotions that can happen with transplant. Excitement. This is just going to be wonderful. I'll be able, with kidney, I'll be off of dialysis. I'll be able to have a better life. Relief, I made it on the list. Relief when you get the call that an organ is ready. And optimism, I get a second chance. My medical health will be better. Just gratitude and joy that I'm able to get this organ, and hope and happiness of a better life. And so it is typical that an individual within the transplant journey will experience the ups and downs, the challenges, the positive emotions throughout the entire transplant process. And your transplant team will be guiding you throughout the process to identify these emotions throughout the process. And they are typical and expected. There's going to be ups and downs. So for example, at the onset of illness, there may be a lot more challenging and negative emotions, maybe some anger, maybe some guilt at the beginning of the process. And then with listing, there might be a lot more hope. People are on the list. There might be a lot more hope, excitement. And then at the time of the surgery, there might be a little more anxiety going on. And then post-surgery, again, a little more of a roller coaster of emotions. Initially, it might be more hope, but followed by maybe some confusion about what the next steps may bring. Again, with changing roles, even then things will go down, but they will go back up again. And the transplant process is up and down, but with the downs, there will be ups again with just changing emotions. There is the typical roller coaster of emotions, both positive and negative, but there are more of the worrisome and more consistent negative emotions of depression and anxiety that we should look out for, which are very common within the transplant population. There's a significant impact of psychiatric illness in the transplant population, both in the pre and post-transplant population. As with other chronically ill patients, organ transplant patients are at higher risk for psychiatric illness. With the pre-transplant population, nearly 1/4 of lung transplant patients currently or previously experienced either anxiety or depression, 1/3 of liver, nearly 40% of patients in end-stage renal disease, and almost half of heart transplant patients. The prevalence of clinically significant depression or anxiety remains elevated over the general population. And some studies show equal or even greater rates as compared to other chronic disease populations. Over half of transplant recipients either experience depression or anxiety immediately following transplant or up to several years post-transplant. While the rates of the general population range about 3 to 10%, other chronic illnesses such as heart disease, diabetes, even kidney disease and lung disease between 10 to 40%. So these elevated rates of depression and anxiety in the post-transplant population, it can be contributed to some of the stressors associated with the recovery, even the medical regimen necessary post-transplant, and some of the adjustments necessary for the role changes post-transplant life. To date, however, the findings on whether depression and anxiety predict transplant outcomes are mixed. And it's very much related to several factors, including adherence to medications, which is very important, as well as caregiver support. There's a large study that included all solid organ transplant recipients and found that depression does increase the relative risk of mortality as well as increases the risk of graft loss, specifically in kidney transplant recipients. So all of this information really lends the need to address mental health in the transplant population and the importance of taking care of one's mental health throughout this complex period of time. And kidney disease, and with all the other organs as well, it's also an incredibly significant issue. And even prior to transplant, is a high rate of mental illness. So nearly 1/4 of patients with kidney failure are diagnosed with depression, and almost half report depressive symptoms. The burden and severity of depression symptoms vary among patients. So the question is, how do you know if someone or yourself is struggling rather than having the regular ups and down emotions as we had discussed with transplant? So some of the warning signs that someone does need help are, so one of the most important ones is ongoing sadness or irritability, that it's persistent, that it's lasting a couple weeks at a time, that one of the other ones that it's important to look out for is lack of interest, which means not finding any joy in activities that someone usually enjoyed. So if someone usually enjoys spending time with family, spending time with friends, hobbies that they usually enjoy, that they just don't enjoy it anymore, that's lack of interest. Any thoughts of self-harm or feeling that things are just better if they weren't alive, those are also warning signs. Excessive fear or anxiety, ongoing panic attacks, also warning signs that people are struggling. Another one is changes in eating or sleeping habits, and that can be either increased or decreased. So someone is eating more than usual or eating less. And same with sleeping excessively or sleeping much less. So those are also warning signs. Other things to look out for is feelings of hopelessness or excessive guilt. Those are also warning signs. People are just not functioning. They're not being able to get out of bed, addressing their daily activities of living. Those are things to also look out for, that they're really struggling and do need additional help. So things that can help. One of the things that can help is individual therapy. Individual therapy improves coping skills and it helps process emotions. Individual therapy can help with both depression and anxiety. It helps add a support system. It helps add an advocate for the patient. Therapy can helps the person gain a better understanding of themselves, how to handle emotions, how to help strategies, how to cope better. And it also can help set goals, whether they're small goals, of daily goals of how to set a schedule, or even larger goals of what they see their future to look like. So individual therapy is something that can definitely very much help people who are struggling. There also is a significant role medications can play as well, in addition to individual therapy. So antidepressants is something that's often prescribed. It can help manage both anxiety and depression. And it's very important to work closely with the prescribing provider. And appropriate providers can range from primary care providers, or for kidney disease, for nephrologists, or sometimes surgeons, or that your transplant team can also provide antidepressants, as well as psychiatrists or nurse practitioners, psychiatric nurse practitioners. All of those can help become part of the prescribing team. So antidepressants can help manage both the anxiety, depression, and it's helpful to weigh risks and benefits when choosing antidepressants and figuring out if an antidepressant is the way to go to help someone who's struggling with anxiety and depression. It's also important to speak with your provider regarding any dose adjustments that are necessary based on whether you have kidney disease or liver disease or heart disease, to see if there's any adjustments that are necessary when choosing a medication. So there are benefits to both therapy and medications in helping those who are struggling throughout the transplant journey. So the next step is how to figure out how to reach out for help and finding a mental health provider. So we talked about that you can get a prescriber, your primary care provider, other people that can prescribe medications, but oftentimes a mental health provider, especially for therapy, how to find a therapist. So referrals, your primary care provider often can give you a referral. Your transplant coordinator or your social worker can help with those referrals, and your insurance company can often help. A resource that I provide a lot of patients with as well, it's psychologytoday.com. It's an easy and convenient way to help also search for a therapist. And a lot of other mental health providers also post their information on psychologytoday.com. So it's a website that you can filter for zip code, insurance type of therapist that you're looking for. And most therapists post their information on psychologytoday.com. And it's a convenient way to help filter and search for a mental health provider. And you can often find their phone number and contact them directly through the website. So that's a resource that's available nationally, and you can find providers that are available. And a lot of them right now, especially, are doing virtual visits due to COVID. In addition to psychologytoday.com, there are also other support groups that are transplant specific groups. So one support group that's specific to kidney is called the National Kidney Foundation Peers, and the phone number is there, and I'll have this up at a slide at another point at the end of the talk. And the National Kidney Foundation Peers it's aimed at anyone who needs dialysis or transplant or is having a hard time on dialysis, or anyone that's considering becoming a living donor. So they pair them up with a peer, and the peer is someone who's living with kidney disease or living donor, or someone that's gone through the process. And the peers have gone through a training program. They're not medical professionals, but they connect them with someone who needs that support, and it's confidential, and you're able to connect with someone who's gone through a similar situation. TRIO also has support groups that you can connect with, and there's also Facebook groups. There's both national and local groups that you can connect with and have that support. And the idea around support groups is being able to find a group of people that have gone through similar things or who are going through the similar process that you are. And support groups are also available. Your transplant team, your coordinator, your social worker can also help set you up with support groups that are either organ specific, that can help you navigate through the process and speaking with other people who have gone through a similar situation. There are also some other ways to manage stress and trying to be creative with it. It's trying to figure out ways to, throughout this difficult journey through transplant, is to try to find other ways to kind of slow down and being positive at times. So one thing that I recommend a lot of people is to create a schedule. So despite everything else being somewhat chaotic, still trying to keep a schedule, establishing a routine. So for example, trying to stick to getting up at the same time in the morning, going to bed at the same time in the morning, keeping some positive sleep hygiene, which includes limiting screen time at night so you can get a good night's rest, trying to get outside during the day, taking a walk, exercising as much as possible. Know that it's hard with depending on medical conditions, but doing as much as possible, at least getting outside, getting some fresh air. And I also think it's very important to have some sort of, if it's not work during the day, some sort of a productive activity, volunteering or something that you are looking forward to be doing during the day. And connecting with family and friends, whether it's virtually or over the phone or in person, doing something that's you're connecting to other people. And others find that breathing exercises can be very helpful, and meditation as well. So as we spend so much time focusing on the patient, it's also important to focus on the caregiver, who also plays a crucial role in the transplant process. So Rosalind Carter, the former First Lady of the United States, once said, there are only 4 kinds of people in the world: those who have caregivers, those who are currently caregivers, and those who will be caregivers. Caregiving is universal. So caregivers are a vital part of our healthcare team. They provide emotional support, they're advocates, and the role of the caregiver can change depending on illness, severity, and where the patient is in the transplant process. So if they're at the beginning of the transplant process, that caregiver role can be very different than when they're in surgery or when they're post-surgery. And needs of the caregiver can often, unfortunately, be overlooked as the healthcare system mainly focuses on patients. And it's so important for things to remember when we're caring for someone with chronic illness. The roles in that relationship between the caregiver and the patient, they can change, especially with spousal relationships. And the caregiver has to be that advocate for that loved one. So that role sometimes can change. And so it's also very important for that caregiver to set aside personal time, despite all the pressures of being a caregiver. And as there are for the patient, there's a roller coaster of emotions in the transplant process for a caregiver. Caregivers can feel overwhelmed. They might feel like, I can't do this all by myself, but who else is going to do it? There might be some fears, some anxiety. What if I mess up? What if the medication is wrong? What if I don't get them to that appointment? There might be some frustration. What if my loved one isn't following what his or her provider is telling him or her what to do? There might be some anger. Why me? Why my loved one? Why are we going through this? There might be some guilt, why should I be feeling overwhelmed? Why shouldn't I be feeling better? Why shouldn't I be feeling grateful that my loved one was able to get a liver or a kidney or a heart? Maybe some resentfulness. Why am I in this situation? Shouldn't my loved one be doing more at this point? There also might be some feelings of loss and grief. I miss our prior relationship. I miss how we used to be. But these are also normal and kind of expected emotions. There might be some hopefulness and excitement that my loved one is getting better. So the definition of caregiver stress and burnout, it's a state of emotional, mental, and physical exhaustion that results from feeling used up due to several demands on one's energy, strength, and resources. So the causes of caregiver burnout, sometimes there's conflicting demands. The caregiver might just also be working or taking care of other people in the household. There's also just ongoing workload. There's also emotional and physical exhaustion, depending on the needs of the loved one. There also might be lack of support or lack of respite for the caregiver. Some of the signs of caregiver burnout, there might be their own physical illness, irritability, anger, resentment, hopelessness, fatigue, worry, feeling overwhelmed. So similar with warning signs for patients who are struggling with transplant, similar warning signs for caregivers that are struggling, the same kind of warning signs that we look out for. Depression, anxiety that are persistent. We should also look for those and figuring out if those are present, then getting them referrals into mental health treatment. And so part of it, trying to figure out how to work on preventing some of that caregiver stress and burnout is also important. So helping them willingness to give up some of the control and asking for help when necessary and delegating tasks to others is very important. And there's also support groups, and we'll discuss that as well, some of the caregiver resources and reaching out for help when necessary. And again, when it gets to a point that it is worrisome, considering individual therapy and not neglecting one's own mental health. Also important, staying connected to family and friends. And then understanding the limitations that the caregiver, despite such an important role, they cannot cure the loved one's illness. They have their own limitations. So there are a lot of caregiver resources out there. So Maryland Trio, it's the organization committed to improve the quality of life of transplant candidates and recipients. And again, I'll have the slide at the end, and there's also will be a handout that'll be available. There's Call to Care, which is a program for family caregivers, and it's based at Johns Hopkins Bayview, and it prepares and supports people caring for loved ones with health-related needs through support groups, classes, and events. There's also the Caregiver Action Network, which is a national organization that offers education, peer support, and resources for caregivers. Well Spouses Association focuses on the needs of spouses caring for chronically ill or disabled husbands, wife, or partners. And it really focuses on that caregiver relationship with spouses, which is very important. And then the Maryland Department of Aging also offers family caregiver support program, offers information available services such as counseling, respite care, and support groups. So again, for your transplant and mental health needs, the mental health resources, both for patients as well as caregivers, if there's concern or warning signs, or if people need to get into therapy, there's psychologytoday.com. And then there's this other website for COVID resources that have both financial and mental health resources. And it's a website that's been very helpful for a lot of our transplant patients. It's through the Behavioral Health Systems of Baltimore. And again, I'll have this on the last slide. And then we'll open it up to questions and answers. And there's my contact information.
Okay, so thank you, Dr. Sarah. I will go ahead and read a couple of the questions that we've received. Mark asks, is mental health screening a part of the evaluation of a potential donor?
Yes, so the mental health screenings, so typically the social worker will start the mental health screening, and if there's any concerns or if they have any questions, then there will be more screening from there.
Okay, thank you. We have an anonymous attendee who asked, are pre-transplant psych evals always done? I'm a caregiver of someone who hasn't had one and I suspect is depressed. Are all or some meds contraindicated?
Sorry, say that one more time.
I'm a pre-transplant psych eval. I'm sorry. Are pre-transplant psych evals always done? I'm a caregiver of someone who hasn't had one and I suspect is depressed.
So pre-transplant psychiatric evaluations are not always done on all patients. It depends on so patients are always screened, and then a psychiatrist or mental health provider will then be consulted depending on then the transplant team will then refer them. And it depends if the family or the patient feels like they need additional support, then yes, then they can be referred. And it's not I think it's so important to recognize that mental health or depression or anxiety, it's not contraindicated for transplant. That it's not contraindicated, and part of it is trying to get people into care, get people managed and treated to be able to have the most successful transplant. Mental health is not contraindicated.
Yes. Let's see. Dwayne asks, I've had my kidney disease since I was 6 years old and received my transplant in 2015. Do you know what the effect of the pandemic has on mental health among transplant recipients?
The mental health on transplant recipients and everyone has been very challenging especially for transplant patients and candidates. It's been very challenging. And so that's why I think even more so within the pandemic times and COVID and all that, I think it's even more important to reach out for help when we need it, when patients need it. I think it's just so important.
Okay, thank you. Lee asks, are post-transplant medications known to cause or exacerbate any anxiety/depression?
Yes, so post-transplant medications can cause anxiety and depression. And so it's definitely important to monitor that, talk to your providers post-transplant. And if there's any either worsening anxiety or developing anxiety or depression, then oftentimes we treat through that. So we treat with medications to help with that anxiety and depression if they're caused by the rejection medications.
Okay, thank you. This is kind of a long one from Jim and Carla Light. What is the best way to communicate to the transplant team you are having issues? In my case, it was a side effect of the anti-rejection dosage post-transplant. I couldn't put my finger on what the issue was with talking with the transplant team, but got to the point that I would go from calm to full rage in a heartbeat. Finally, when I was transferred back to the pre-transplant hepatologist, I don't know how to say that, hepatologist, I said something to him. He immediately cut the dosage in half, and the reduction in the symptoms was nearly immediate, falling off the pre-transplant normal over the next couple of months.
Yeah, it's not, I see a lot of patients that happens as well. And I think it's just so important. I'm glad that you were able to advocate for yourself and keep letting your team know that something was off, that something just didn't feel right. And I think it's, it's different when it's so psychiatric illness. Oftentimes it's not as clear cut as high blood pressure. You can see the values when they take your blood pressure, it's elevated, or if your blood sugars are elevated. Sometimes it just feels different. I just don't feel right. And I think just continuing to advocate for that is the best that oftentimes that you can do, and continuing to tell your providers, continuing to tell people, getting a second opinion, I think would be appropriate if it's just not feeling right. And oftentimes if they're able to change doses around, sometimes they can't based on the rejection medications and your transplant, then they might refer you to, if there's other issues going on, to a mental health provider as well.
Thanks, Sarah, Dr. Sarah. The next question from Tammy: will psych medication along with other medications for a liver transplant have an overbearing effect on the liver?
So one thing that I think is so important with a lot of the psychiatric medications, specifically with liver, making sure that your whole team is aware of the liver disease, making sure that you're on right doses, because with certain end stage organ disease, some of the medications, not only psychiatric medications, definitely can impact the dosages and the effects of it. So it definitely can be more challenging with liver disease, for example, with dosing.
Okay, thank you. I am going to wrap that up. So thank you, Dr. Sarah Andrews, for sharing with us. Thanks to Trio Maryland for the great programming and informative event. This concludes our sessions for today, but we encourage you to jump into the closing Zoom sessions and raffle. So I am putting that link in the chat right now. I'll leave that up for the next few minutes so that you can hop over to that. So it will open at 12 o'clock. And we will be doing a raffle of 25 items. So thank you again